Hello, listeners of the Vox Herald podcast. I'm San Juan, and today we're diving into a pressing health issue that's gripping Manitoba and has lessons for all of Canada, including right here in New Brunswick. Imagine you're at a medical clinic in Fredericton or Moncton, going about your day. When you hear that someone there might have been exposed to a highly contagious disease, that's exactly what's happening in Morden, Manitoba, where public health officials are sounding the alarm about new measles exposures. On July 3, 2025, 2 potential exposure incidents were reported at the Menzies Medical Clinic and Dynacare, live on Stephen Street, with Manitoba Health urging anyone present to monitor for symptoms until July 25th. This isn't just a local story, it's a wake-up call about the resurgence of a disease we thought was under control. Measles is no small matter. It's highly infectious, spreading through the air when someone coughs or sneezes, and can linger in a room for hours. Manitoba has reported 130 confirmed cases and 8 probable cases this year alone, a sharp rise from the 116 confirmed cases just a week earlier. For perspective, that's the highest in decades, signaling a public health challenge that demands our attention. Why is this happening now, and what does it mean for New Brunswick? Are we prepared if measles knocks on our door? Today, we'll unpack the outbreak's history, Health Canada's role, and how it affects communities like Moncton, Miramichi, or the Acadian Peninsula. We'll hear from healthcare providers, patients, and experts, and explore what Canada can learn from global responses. So, stick with us, and let's get to the heart of this health crisis. Have you checked your vaccination status lately? Let's talk about it on X. This episode will cover the historical context of measles in Canada, analyze Manitoba's outbreak, and explore its impact on New Brunswick. We'll hear from stakeholders, doctors, public health officials, and community members, compare Canada's approach to other countries. By the end, we'll discuss what's next and how we can stay prepared. Let's start with a look back at measles in Canada. To understand the Manitoba measles outbreak, we need to rewind and look at the history of this disease in Canada. Measles, caused by a virus in the paramyxovirus family, was once a common childhood illness before vaccines. It infected nearly every child, causing fever, rash, and sometimes severe complications like pneumonia or encephalitis. In the 1960s, Canada introduced the measles vaccine, and by 1998, the country declared measles eliminated due to widespread vaccination with the MMR measles mumps rubella vaccine. This was a public health triumph, driven by Health Canada's immunization programs and provincial efforts. But elimination doesn't mean eradication. Measles can still enter from abroad or spread in under-vaccinated communities. In the early 2000s, Canada saw occasional measles outbreaks, often linked to travel or vaccine hesitancy. A notable 2011 outbreak in Quebec saw over 700 cases, mostly among unvaccinated children in a religious community. Health Canada responded by strengthening surveillance and promoting the 2-dose MMR schedule, one at 12 months, another at 4 to 6 years. New Brunswick, with its robust public health system, played a key role in maintaining high vaccination rates, particularly in urban centers like Fredericton and St. John. Rural and Indigenous communities, however, sometimes faced access barriers, a challenge Health Canada has worked to address through mobile clinics and outreach. Fast forward to 2019. Canada faced another scare with 113 cases, mostly in British Columbia, tied to vaccine skepticism fueled by misinformation. Health Canada launched campaigns to counter myths, emphasizing that the MMR vaccine is 97% effective after 2 doses. New Brunswick saw minimal cases, thanks to high immunization rates, but gaps persisted in remote areas like the Quebec First Nation. The COVID-19 pandemic disrupted routine vaccinations, dropping rates globally and in Canada. By 2023, Health Canada reported a 5% decline in childhood MMR coverage, a red flag for outbreaks. Manitoba's current outbreak, starting in early 2025, is the largest since the 1990s, with 130 confirmed cases by July 5th. It's concentrated in southern Manitoba, including Morden and Winkler, areas with historically lower vaccination rates due to cultural and religious beliefs. Health Canada's role has been to support Manitoba Health with surveillance, vaccine supply, and public messaging. New Brunswick, while not yet affected, is watching closely, as its rural communities, like those in Gloucester County, could be vulnerable if cases spread. Globally, measles resurged in the 2010s due to vaccine hesitancy. The World Health Organization reported 869,770 cases worldwide in 2019, with major outbreaks in the US, Europe, and Africa. Canada's response, coordinated by Health Canada, has been more proactive than many, but challenges remain. In New Brunswick, the Arlingijo Vitalite Health Network's vaccination drives helped maintain coverage, but the province's aging population and healthcare worker shortages raise concerns about outbreak preparedness. This history shows measles as a persistent threat, even in vaccinated populations. Manitoba's outbreak highlights how quickly it can spread in under-vaccinated pockets. A lesson for New Brunswick as we face similar risks in rural and Indigenous communities. Let's now break down the specifics of Manitoba's situation. The Manitoba Measles Outbreak. As reported on July 10, 2025, centers on 2 exposure incidents in Morden at the Menzies Medical Clinic and Dynacare lab on July 3. These events are part of a broader surge, with 130 confirmed and 8 probable cases in 2025, up from 116 confirmed cases a week earlier. Let's unpack what's happening, how it's being managed, and what it means for Canada. Mechanics of the outbreak. Measles spreads through airborne droplets, lingering in spaces for up to 2 hours. An infected person is contagious from 4 days before to 4 days after the rash appears. Symptoms: fever, cough, runny nose, red eyes, and a rash emerge 7 to 21 days post-exposure. In Morden, the exposures occurred at a busy medical clinic and lab. Higher risk settings due to close contact and vulnerable patients. Manitoba Health's response includes contact tracing, exposure notifications, and vaccine clinics. Those at the Morden sites are urged to monitor symptoms until July 25 and check MMR status. The MMR vaccine, given in 2 doses, is the gold standard for prevention, offering near total immunity. Health Canada's role. Health Canada oversees national immunization guidelines, ensuring vaccine supply and coordinating with provinces. In Manitoba, it's providing technical support, including lab testing to confirm cases and funding for extra vaccine doses. The agency's surveillance system. The Canadian Measles and Rubella Surveillance System, CMRSS, tracks cases and informing alerts like the Morden warning. Health Canada also funds public awareness campaigns, emphasizing vaccination and debunking myths, for example, the false link between MMR and autism. Manitoba's strategy. Manitoba Health has issued 24 exposure warnings in 2025, targeting schools, hospitals, and clinics. The Morden incidents are notable for occurring at the same location, suggesting a single infected individual. The province has expanded vaccine eligibility to infants as young as 6 months in high-risk areas like Southern Health. Contact tracing is challenging in public settings, so Manitoba relies on broad alerts, urging people to self-monitor and vaccinate. The 14-case jump from June 28 to July 5 indicates ongoing transmission, likely in under-vaccinated communities. Why Manitoba? Southern Manitoba, including Morden, has pockets of vaccine hesitancy, often tied to religious or cultural beliefs. A 2019 study found MMR coverage in some Manitoba communities as low as 70%, below the 95% needed for herd immunity. The province's diverse population, including Mennonite communities, adds complexity, as some groups historically decline vaccines. Health Canada's culturally sensitive outreach, like translated materials, aims to bridge this gap. New Brunswick connection. While New Brunswick hasn't reported measles cases in 2025, the Manitoba outbreak is a warning. The province's rural areas, like Restigouche County, have vaccination rates as low as 85% in some communities, per 2023 data. Indigenous groups, such as the Mi'kmaq and Malasite, face access barriers due to limited clinics. Health Canada's Indigenous Services branch has prioritized mobile vaccination units, but shortages of rural nurses, a 20% vacancy rate in New Brunswick's Horizon Health Network, complicate delivery. If measles reached Moncton or Bathurst, crowded ERS could amplify spread, as seen in Manitoba's Boundary Trails Health Centre. Technical details explained. Think of measles as a wildfire. It spreads fast in dry conditions, unvaccinated populations, and needs a firebreak vaccines to stop it. The MMR vaccine is like a fire retardant foam, highly effective but only if applied widely. Health Canada's 2-dose schedule ensures long-term immunity, but breakthrough cases can occur in partially vaccinated individuals. Infants under 6 months, pregnant women, and immunocompromised people can't be vaccinated, making them reliant on herd immunity. Manitoba's response, backed by Health Canada, includes post-exposure prophylaxis, for example, immunoglobulin for high-risk groups, which must be given within 6 days of exposure. Challenges. Manitoba's outbreak highlights systemic issues. Vaccine hesitancy, fueled by online misinformation, remains a hurdle. Health Canada's 2024 campaign, Vaccines Save Lives, counters this, but ex-posts show persistent skepticism. Overstretched healthcare systems. Manitoba's wait times hit 10 hours in 2025, hamper contact tracing. In New Brunswick, similar pressures could delay response if cases emerge. Immediate impacts. The Morden exposures risk further cases, especially among unvaccinated children or adults born after 1970 who may have only 1 MMR dose. Manitoba's schools and daycares reopening soon could amplify spread without swift action. New Brunswick's public health teams are on alert, with Health Canada providing guidance on outbreak preparedness. This analysis shows Manitoba's outbreak is a complex challenge, rooted in vaccine hesitancy and healthcare strain. with lessons for New Brunswick. Let's now hear from those affected. To understand the Manitoba outbreak's impact, we need to hear from all sides: public health officials, healthcare providers, patients, community leaders, and critics. New Brunswick voices add local context. Health Canada emphasizes vaccination as the cornerstone of measles control. Dr. Teresa Tam, Chief Public Health Officer, stated in a July 2025 release, "The MMR vaccine is safe and effective." Manitoba's outbreak underscores the need for 95% coverage. The agency supports Manitoba with resources and data, urging provinces like New Brunswick to bolster surveillance. Critics argue Health Canada's messaging lacks reach and skeptical communities, a gap it's addressing with targeted X campaigns. Manitoba Health, provincial officials led by Dr. Brent Roussain are focused on containment. "We're tracing contacts and expanding vaccine access," Roussain said on July 10th. They've set up pop-up clinics in Morden and Winkler, but face pushback from vaccine-hesitant groups. Manitoba Health praises Health Canada's support but calls for more federal funding to hire contact tracers. New Brunswick Public Health, Dr. Jennifer Russell, New Brunswick's Chief Medical Officer, told CBC in July 2025, "We're monitoring Manitoba closely. Our vaccination rates are strong, but rural gaps worry us. The province is stockpiling MMR doses and training us staff for potential cases." Learning from Manitoba's hospital exposures, Russell stresses community engagement, especially with Acadian and Indigenous groups. Healthcare providers, Dr. Sarah Klein, a Morden pediatrician, shared on X, "We're seeing unvaccinated kids in clinic, and it's heartbreaking. Parents need clear info." New Brunswick's Dr. Marie Leclerc, a Moncton family doctor, echoes this. "Rural patients often can't access clinics. We need mobile units." Nurses like Fredericton's Emma Chen report burnout, with 12-hour shifts limiting outbreak preparedness. Patients and families in Morden. Parent Lisa Bergen told CTV, "I vaccinated my kids, but I'm worried about daycare exposures." In New Brunswick, Bathurst's Marie Doucette, a mother of 3, said, "I checked our records after hearing about Manitoba. We're up to date. But what about others? Unvaccinated adults, like Winnipeg's John Friesen, express regret. I didn't think measles was a risk. Now I'm getting vaccinated." Community leaders, Morden's Mennonite community leaders, like Pastor David Weeb, are working with Manitoba Health to promote vaccines sensitively. In New Brunswick, Chief Rebecca Knockwood of Fort Folly First Nation told Global News, "Our elders are at risk. We need Health Canada to fund more clinics on reserve." Acadian leaders in Caracat call for French language outreach to boost trust. Critics and advocates, vaccine skeptics, active on X, argue Manitoba's alerts fuel panic and question MMR safety, citing rare side effects, for example, 1 in 1 million risk of anaphylaxis. Health Canada counters with peer-reviewed data showing 99.9% safety. Advocacy groups like Immunize Canada push for mandatory vaccination policies, but Manitoba and New Brunswick resist, citing personal choice. New Brunswick's Health Council warns that rural healthcare shortages could worsen outbreaks. These perspectives highlight the tension between public health mandates and individual beliefs, with New Brunswick stakeholders urging proactive measures. Let's explore the local and national impact. New Brunswick impact. New Brunswick's 750,000 residents, spread across urban hubs like Moncton and rural areas like Miramichi, face unique risks. The province's 90% MMR coverage is above Manitoba, but below the 95% herd immunity threshold in some rural pockets. If measles reached Fredericton's Dr. Everett Chalmers Hospital, similar to Morden's exposures, crowded ERS could amplify spread. Indigenous communities, like El Sipogag First Nation, are vulnerable due to limited healthcare access only. One clinic serves 3,000 residents. Acadian communities in the Northeast rely on the Vitalite Health Network, which reports a 15% nurse shortage. Health Canada's $10 million investment in rural vaccination since 2023 helps, but local leaders demand more. National impact. Manitoba's 130 cases signal a national concern. British Columbia reported 102 cases in 2025. Alberta, 1,078, reflecting a Canada-wide resurgence. Health Canada's CMRSS data shows 1,500 plus cases nationwide, the highest since 1992. This strains hospitals, with Winnipeg's Health Sciences Centre reporting 20% capacity issues. Other provinces, like Ontario, are boosting vaccine clinics. Learning from Manitoba, Health Canada's $50 million emergency fund supports provinces, but critics argue it's insufficient for rural outreach. International comparison. The U.S. reports 1,288 cases in 2025, driven by vaccine skepticism in Texas. Per the CDC, the FDA's response mirrors Health Canada's, emphasizing vaccination, but faces stronger anti-vaccine pushback. Europe's EMA reports 10,000 cases, with lower vaccination rates in countries like France, 85%. Canada's proactive alerts and free MMR vaccines give it an edge, but global travel risks importation, as seen in Manitoba's early cases. New Brunswick's preparedness hinges on closing rural gaps, while Canada must sustain high vaccination rates. But let's look at what's next. Long-term effects. Manitoba's outbreak could lead to sustained measles transmission if vaccination rates don't improve. Complications like pneumonia 1 in 20 cases or encephalitis 1 in 1,000 could strain hospitals. New Brunswick risks similar issues if rural coverage lags. Nationally, declining trust in vaccines down 10% since 2020 per Angus Reid could fuel more outbreaks. Economically, outbreaks cost millions in healthcare and lost productivity. 2025 cases already cost $5 million. Solutions. Health Canada should expand rural vaccine access, like mobile clinics in New Brunswick's Acadian and Indigenous communities. Targeted campaigns, using trusted local voices for example, Acadian radio, can counter misinformation. Manitoba's model of pop-up clinics could work in Miramichi federally. Health Canada could pilot incentives, like tax credits for vaccinated families, while respecting choice. International collaboration, like WHO's measles elimination plan, could strengthen Canada's defenses. New Brunswick focus. The province should prioritize nurse hiring and mobile units. Community engagement, like town halls in Bathurst, can build trust. Health Canada's Indigenous services must fund on-reserve clinics to protect vulnerable groups. These steps can curb measles spread, ensuring safety for all Canadians. Let's wrap up. The Manitoba measles outbreak is a stark reminder of how fragile public health gains can be. With 130 cases and counting, it's a call to action for Health Canada, provinces, and communities like New Brunswick to stay vigilant. We've explored the outbreak's roots, Health Canada's response, and its implications for Moncton, Fredericton, and beyond. Vaccination remains our best defense, but access and trust are critical. Listeners, check your MMR status and share your thoughts on how can New Brunswick prepare. Let's keep this conversation going. On July 10, 2025, Health Canada issued a national advisory urging Canadians to verify MMR vaccination status amid rising measles cases. The agency is boosting vaccine supplies to Manitoba and other provinces, including New Brunswick, where 10,000 extra doses were sent in July. Health Canada also launched a new X campaign, #VaccinateCanada, to counter misinformation. Stay informed at www.canada.ca/health.